The global coronavirus death toll has officially surpassed 4 million, but health officials believe that number is likely much higher. The U.S. accounts for more than 15% of that total, with more than 606,000 lives lost. Meanwhile, infections are on the rise in almost half of the country, largely due to the more contagious Delta variant. And officials warn that the most severe cases are occurring in people who are still unvaccinated. Janet Shamlian has the latest from Houston.
Lana, hospitals across the country are seeing it, and the White House task force is sounding the alarm. A rapid rise in the Delta variant. And now Pfizer says it is working on a booster shot specifically to target that variant.
Tonight, a dire situation is unfolding. The dangerous Delta variant, highly transmissible and threatening the unvaccinated, is significantly more widespread, according to researchers. 5 under-vaccinated areas of the U.S. could be putting the entire nation at risk, according to researchers at Georgetown University. The fear is the virus could mutate so significantly in these areas, it could defeat vaccines.
This rapid rise is troubling.
To be clear, there will likely continue to be an increase in cases among unvaccinated Americans.
A study published today in the journal Nature suggests getting just 1 dose of a vaccine offers little protection against Delta. Currently, 25 million people have received only 1 dose, and 140 million are unvaccinated, leaving 45% of the country at risk. It's a critical concern in places like Missouri, where Delta is now 73% of COVID cases. Dr. Fauci saying again today, those most vulnerable in low vaccination areas should take precautions.
If you are an elderly person, or if you have a person with an underlying disease, you might want to go the extra mile of protection of wearing a mask if you were indoors.
In Texas, a youth camp outside Austin may become the nation's latest super spreader event. More than 100 confirmed cases.
We believe that this is an outbreak of the Delta variant.
At Houston's Methodist Hospital, COVID hospitalizations are rising. The Delta variant, responsible for 42% of new cases.
Are you concerned about the unvaccinated?
The majority of patients that we are seeing hospitalized with COVID-19 with the Delta variant, the vast majority of those patients are unvaccinated.
Here at Houston's Methodist Hospital, they say they expect Delta to make up 90% of the COVID cases in the next 2 to 3 weeks. And they say the patients are generally young. Lana?
Janet, thank you. For more, let's bring in Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, as we just saw, researchers say that the virus could continue to mutate in under-vaccinated areas. Cases are already on the rise in nearly all of these communities. How concerned are you about this?
What we're going to see is this differential impact of the Delta variant and other variants on the unvaccinated population. And in certain parts of this country, places like Missouri, Arkansas, Mississippi, Louisiana, Nevada, there is going to be enough unvaccinated individuals that you're going to see cases continue to increase and then start to create an uptick in hospitalizations. In some places, you might see hospitals reach uncomfortable levels again. And the thing about this is completely preventable. It's something that we have the ability to control by just getting more vaccine into people's arms. Our vaccines work really well. So I do think we're going this route where we're going to have 2 countries, one where COVID-19 is managed much more like other respiratory viruses, and another part of the country where COVID-19 is still a disruptive force.
Well, I want to talk to you about what you were just saying in terms of the hospitals, because a new study conducted by the NIH and the CDC found that 1 in 4 coronavirus deaths may be attributed to hospitals being strained by surging cases. How could this have been avoided? Looking forward, what kind of support do healthcare facilities need to tackle future healthcare crises? And are we prepared for the continued variants that are mutating and becoming ever more powerful?
So hospital preparedness is something that's long been neglected. It's not something that hospital CEOs even prioritize. And we know during the peak of COVID-19 in the spring of 2020, in the winter of 2020, 2021, hospitals were inundated and we couldn't provide the best care to those patients because we had so many of them, and people's care suffered. And it's not surprising that mortality increased and deaths increased when you didn't have the resources or the personnel to be able to take care of these patients with the standard of care. And I think that's something something that we have to remember, that if our hospitals go into crisis, whether it's from COVID-19, whether it's from influenza or whatever it might be, all of the care in the hospital is going to be compromised. And that's especially going to be the case if you're in an unvaccinated area and a lot of high-risk people are not vaccinated, like what we're seeing, for example, in Springfield, Missouri. Those hospitals are going to be overly taxed, and you're going to get worse outcomes. People are going to die that don't necessarily need to die because those hospitals are stressed out. So you have to remember, if you're a community member in a place that's unvaccinated, you're going to put your own community hospital into trouble if you don't get vaccinated. So I think this is a message that really needs to be driven home, that our hospitals are fragile. Our healthcare system doesn't have the ability to respond so well. And I think that continues to be a theme with COVID-19 in those unvaccinated areas. And it's going to be important for the next pandemic or next infectious disease emergency we face.
Really important understanding of that particular problem. I also want to ask you about a new study published in the journal Nature, which found that the Delta variant is resistant to certain antibodies that target the virus. Tell us, what does it mean that these variants can evade antibodies, and how does this affect vaccines, booster shots, and how we're tackling the Delta variant and other variants going forward?
So the Delta variant has a cluster of mutations in its spike protein, and that's what many of our antibodies target, that spike protein. So for example, when you hear about monoclonal antibodies by companies like Regeneron, that's what they're doing. They're targeting that spike protein. And certain variants have proved problematic for our monoclonal antibodies. So the Eli Lilly monoclonal antibody has been withdrawn from the market because the variants have made it obsolete. So that's always going to be a challenge. But when it comes to vaccines, it does appear that 2 doses of the Pfizer and Moderna and even the single-dose Johnson & Johnson appear robust against the Delta variant and other problematic variants. But you've got to remember, what we want these vaccines to do is to prevent serious disease, hospitalization, and death. And that's where these vaccines really excel. So even if you were to get a breakthrough infection with the Delta variant, and there's been one right here in my hometown in Pittsburgh, that person survived because they were vaccinated. So the vaccines are still instrumental at preventing the severe consequences of any of these variants. And I think it is important to study boosters, especially for immunosuppressed populations where they may benefit from a 3rd dose of the Moderna or Pfizer vaccine. But for the general population, our vaccines seem to be holding up really well when it comes to what matters, the prevention of serious disease.
Well, the global coronavirus death toll has officially surpassed 4 million. Daily deaths, and in many countries, cases, have plummeted since last winter. But what still needs to be done on a global scale for us to put an end to this pandemic?
What we need to do is get vaccine into the high-risk individuals that exist all over the planet. Because until those high-risk individuals are protected, you're still going to see hospitals worrying about oxygen and personnel and PPE. We really have to think about this as a global infectious disease emergency. And until it's controlled in all corners of the globe, until we're not seeing hospitals inundated and cases surging and life disrupted, we are all still going to be disrupted. You're going to end up having the U.S., Canada, UK, and Israel, for example, maybe doing well with COVID, but some parts of the world are still going to be kind of off limits because COVID will still be a disruptive force. So we really have the solution at hand. It's the vaccine. Now it's just designing a way and creating a program and having the political will to get that vaccine into arms all around the world.
All right. Dr. Amesh Adalja, thank you for joining us. Thank you for all that you do.
Thank you.